Hello everyone and welcome to Inside Healthcare. You know, chances are you or someone you know has had cancer. Now we have the opportunity, and you have the opportunity, to help researchers better understand the genetic, environment, and lifestyle factors that either cause or even prevent cancer by participating in the American Cancer Society's Cancer Prevention Study-3, also known as CPS-3. To tell us all about it, we're pleased to have with us Lou Harvin and Holly Guerrera with the Midwest Division of the American Cancer Society. Thank you both for being with us.
And thank you for having us.
Lou and I go way back. We were at Channel 5 just a few years ago.
Way back, a couple of years ago.
Just a couple of years ago.
1, 2, 3.
Something like that. So, and Holly, why don't we start with you? I understand that the CPS-3 is very personal for you. Why don't you tell us why?
Yep, absolutely. I actually, not only am I a staff person with the American Cancer Society, I'm also a volunteer for the American Cancer Society. My mom was diagnosed with lung cancer in 1999. So I saw her through her cancer journey, and that's what brought me to the American Cancer Society. I volunteered with her while I was going to college, while I was taking care of her, and then it just so happened that a job opening opened up at the American Cancer Society, and here I am. But at the same time, I've also been sharing her story because I want to continue her fight and the fight to end cancer, hopefully someday. And when the third cancer prevention study became available through the American Cancer Society, I definitely signed up and took part of the study to definitely continue that fight for her and to end cancer.
Oh, good for you. I mean, that's how the Susan G. Komen thing all started too, with A Sister's Promise too. So good for you. Thanks for doing that. Thank you. So Lou, why don't we tell us about this study? What's it all about?
I call this the bestest study we've ever done, the bestest thing. Check your English grammar and all those good things, but it is the best thing you can ever do in a fight against cancer. For those who think they have no power, no control over cancer, you do. Long story short, CPS-1, there was a Cancer Prevention Study 1. We weren't that clever to call it CPS-1 back in those days. You think C3PO or 3CPO or whatever it is, but CPS-1.
It was probably called Cancer Prevention Study.
That was the study. It was the Prevention of Cancer Study, and it was one. Yeah. But that one done back in the 50s, that was the one that made the first definitive link to smoking and cancer. Some people think smoking was discovered in a lab and a scientist came out and said, smoking, cancer. The American Cancer Society did the study back then, came up with a definitive answer where everyone made it. It was a slam dunk case, no more discussion. Smoking causes cancer. Our study found that.
It's so odd to think about it now, you know, that people didn't realize there was a link.
And in Cancer Prevention Study 2, the end of that is still a couple of years left on that one. And that's the one that made that link between obesity or eating improperly or not getting enough exercise and the links that has to cancer. And we made that connection. I know, and I know our scientists know, and our researchers know, there is so much more to be found out about cancer, and they're going to be able to do it with this Cancer Prevention Study 3. When you think about it, for the people who don't smoke, for the people who do eat healthy, people who don't live next to this disgusting factory, whatever it may be, why are people still getting cancer? Why do you hear about people, it's not in their family, it's not in their genes, it's not in their DNA, and they're getting cancer?
I just heard about someone who died of lung cancer who never smoked. Yeah, so very interesting.
And this study is going to be able to make that link by just asking people questions. You fill out a form, that's all you have to do. When you first go in for the study, we draw blood, small amount, and we do a waist measurement. That's it. We never ask you to come into a lab, or we don't hook things up to your face and you know, you're not walking through a bunch of treadmills, nothing weird. You just fill out a form every other year and they ask you a lot of questions about your lifestyle, and that will give us the information we need to make that final link into what is causing cancer.
And how long will you be following people? For 20 years?
It's for 20 years. Somebody asked me the other day, they said, so we'll be able to get results in 20 years? It doesn't work that way. If we find something a year from now, we're going to tell the world. So it's ongoing, but as our scientists and researchers analyze this data, and they're really good at this, I mean, they're going to be able to pick information as people, 300,000 people nationwide, that's going to give us a good glimpse into what's going on.
So who's eligible to be in this study?
The eligibility requirements, of course, like Lou had mentioned, the most important piece is that people are willing to make a long-term commitment of 20+ years and doing that survey for us every other year at their home, online or hard copy through a paper survey. The second eligibility requirement is we're asking people to be between the ages of 30 and 65, and the third requirement is never been diagnosed with cancer because it is a prevention study.
So why not also study people, even though it's a prevention study, people who've had cancer?
Well, what we're trying to find is how people develop cancer in the first place. And the reason somebody asked me once, why did we do 30 to 65? We don't hate people under 30. It's just they're at that point of their lives where they're so mobile and they're moving around a lot, and they probably won't be as concerned about filling out a form every couple of years. And we do want people to come back. People over 65, the issue there is once you get into your 70s and 75 years old on up, your cancers have already been developed along the way if they're going to show up later. So we're trying to get that the age of 30 when it first manifests itself. How did it get going in the first place? And that's what we're looking for. And
you're looking for, I understand, you want a certain amount that are diverse as well in the study?
Yes, yep, absolutely. We're looking for
minorities.
Yep, for men, we're looking for individuals of all different ethnic backgrounds to be a part of this study.
Because women seem to be good about taking part in studies.
Yes.
And guys will go out and play golf or bowl and do everything else, and we'll fill out a study. Oh, not me. So we need guys. We need to find out.
Women, bring your husbands with you when you come to sign up.
Yeah, very good point there. So you mentioned that they'll be taking a sample of blood. What happens to this blood?
You want to take that one?
Yep, I can take that one, definitely. First of all, we take 7 teaspoons of blood. So that's 4 vials of blood that we're taking, and we explain to people that that amount of blood is the same amount as if you were to go to the doctor for an annual exam. So we don't want people to get scared and that we're taking a lot of blood. So it's 7 teaspoons of blood. And basically what we do is we bring this blood back to our vault and we store it and we run research on it. We look at the blood, like Lou had mentioned, we don't wait 20 years to start researching different hormones and enzymes and different things that are in the blood samples that we're taking. We start looking at these things now. And as people enroll and people continue to utilize the surveys every other year, we take some of that information that we find with the surveys and how people are answering those questions, and we also look at those blood samples as well. So it is for research, so we don't provide any sort of results or lab results to individuals.
And rest assured, we've done these studies, like I said, with 1 and 2 in the past, and none of this information is shared with doctors, not your employer, not your health insurance
all confidential.
No one. This is just information we're studying. This is the one good time it is to be a number. That's all you are to us. You are a number, and we're just looking at the information numerically, but we need people to sign up for the study.
We have just about a minute left in this segment, so quickly, if someone wants to participate, how do they go doing that? I know you're going to some screenings coming up here.
Yep, absolutely. We want them to check out our website, which is cps3twincities.org. And I also wanted to share that the American Cancer Society is partnering with the Healthiest Care System, and they are offering CPS3 enrollments at 3 of their hospital locations. The first one is at St. John's Hospital on June 11th. The second enrollment is at St. Joseph's Hospital on June 13th. And the third enrollment through the Healthiest Care System is on June 20th at Woodwinds Health Campus. And we're encouraging people to check out that website, sign up, pre-register at cps3twincities.org.
And if they're watching this show after those dates have passed, how can they still get involved? Same address?
This is an open window that we have for this 2 or 3 week period. We have 21 locations around the Twin Cities. And I do want to make it clear, it is very important to pre-register by going to cps3twincities.org. The reason is, it's not like voting where you go down and stand in line forever and ever. We take care of you when you get there. You show up for 1 o'clock appointment, we will take you at 1 o'clock, and you will be out of there in 15, 20 minutes. And if you want to change your time of your appointment, you can do all of that. But we will take care of you from the time you show up, and you're not going to stand in line for hours and hours and miss other things to do. So we'll make it as easy and simple on you as possible.
And final comments about CPS3.
It's a life-saving study, so please participate in the study. We're asking everyone to come out that meets that eligibility requirements. It doesn't take much of your time the day of enrollment or even through that 20+ years. It really is going to end the fight against cancer.
Well, thank you both for being with us. Appreciate it. Lou,
Thank
great
you
to
for
see you
having me.
again. And Holly, thank you for being with us. Still ahead, honoring choices and what it's all about and what you need to know about it for you and your loved ones. Thank you.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.
Welcome back, everyone, to Inside Healthcare. Now we turn our attention to honoring choices and advanced care planning. To talk about it, 3 local physicians join us who are involved with a statewide Honoring Choices Minnesota initiative, which is sponsored by the Twin Cities Medical Society. And we're very pleased to have back with us, Dr. Craig Swenson, the Healthy's Chief Medical Quality Officer. Thank you for being back with us. And Dr. Miguel Reyes, a hospitalist and palliative care physician at Regions Hospital, who he also serves as Spanish-speaking patients and families at La Clinica in St. Paul. Thank you. And also we have Dr. Mohammed Aji Aden, who specializes in internal medicine, hospice, and palliative care medicine at Regions Hospital as well. Thank you for being with us.
Thank you.
Really appreciate you all taking time to be with us. So, Dr. Swenson, maybe we can start with you. Exactly what is honoring choices or advanced care planning?
Well, I think that most of the viewers might be familiar with the language called living will. And when they go for their regular wills, their attorney or even their physicians may ask them to complete a living will or an advanced care directive. And honoring choices is a specific program that we have to help individuals complete their living wills.
And what would be the difference between advanced care planning and a living will?
Yeah, these terms can be quite confusing because we don't use them that often. But I think we could think of an advanced care planning as a conversation, as a process, as a dynamic process of really trying to think about what's coming up in the future, what would be the wishes, who we may want to represent us or speak for us if we are not able to give to make medical decisions due to sickness or inability to communicate, and so forth. So that's the concept of preparing for the future, giving an opportunity to express your wishes and views. That would be advanced care planning, where a healthcare directive would be more of the form, the document, one of the elements of that dynamic process, of that conversation that will be reflecting on paper and will constitute more of a legal document in which those desires and wishes are formally expressed.
So who should be involved in this when you're talking with people about your advanced care planning?
Yeah, I see this as a triangle in which you have the patient and the family and the provider, healthcare provider. Healthcare provider, the role of the healthcare provider is to give, talk about, diagnosis, prognosis, options, and give the menu of options, and then also the pros and cons of each option to the patient and family. The patient will listen to the options and the pros and cons of each option, and then the patient and mostly the patient will form in his or her mind, what's called healthcare values, what choices, what preferences that would fit his or her core values.
So this isn't something necessarily that you would do way in advance, just like today, for instance. This is something you may even consider when a patient's in the hospital. Is that what you're saying?
This can be, could be, that can take place, it can take place, during an annual physical exam. I think that's the best opportunity. It's hard when you're in a hospital and dealing with a serious illness. You have a lot of things that come into play at that moment. Anxiety is a factor, pain is a factor, medications that are sometimes sedating and can cloud the patient's state of mind. So it's important to have this kind of discussions ahead of time. That's why it's called advanced care plan. So have these discussions with your physician or healthcare provider, and also with your family. It's very important.
I know whenever I make an appointment now, they always ask that question, do I have a plan and stuff like that, but what if your provider doesn't ask that? How do you start this conversation?
Well, I would think that you can bring it up yourself, although many of us are a little hesitant to bring that type of topic up. And while this discussion is a good one to have once you have a chronic illness or are in advancing years, it's also very important to have that conversation begin earlier in your life with your annual checkup, to just be talking about what are your values, what are your goals, and if you were unable to speak for yourself, if you were to be in an accident or have some serious sudden illness, what choices would you like your health care to take?
What are some of the resources? What's available to people out there?
Well, you know, the web page, honoringchoices.org, would be a great spot to, for the viewers to go out onto the internet and look at the document and can pull the document down. Many of the organizations, Health East, Health Partners, many of the clinic systems have that posted on their own web page as well.
And not only are these resources provided in English, but for those non-English speaking communities, there are translations and documents in 5 languages that can be available, also can be downloaded from the same web page. And also the Honoring Choices website contains a multitude of small video clips and other educational resources that can be viewed by providers, but also by patients and by the community, and can be used as a good kind of a way to start a conversation, which sometimes is a bit of the difficult component of this whole process, is how to start that conversation.
And Honoring Choices has been around for not too long, is relatively new?
Relatively new within the last 5 years, based on a long-standing program from La Crosse, Respecting Choices, and that's the program on which Honoring Choices is built.
And why have this program?
Well,
or the initiative?
The initiative is really important. Again, thinking back to the document, it's so much more than the document to have this living will or healthcare directive. It is really about having the conversation with your family, your loved ones, selecting that healthcare agent, the person that you really want to make certain is participating in the care when you can't and when you can't make those choices. So it's having the conversation with those individuals and in a facilitated way with someone that knows how to answer the questions, what options there are as you complete the document.
Yeah, and doing it in that form, way in advance, is much less stressful for everyone involved. I can't imagine what it must be like when people have to make some decisions and they don't know what the loved one, if they're not capable of talking about it, or what a position that puts them in.
Absolutely. Yeah.
So if someone has this advanced care planning, is it just this conversation and they've talked to so-and-so? What if that person isn't around when something happens, and what happens then?
Yeah, it's important to have a healthcare proxy, or there are different terms used for it, or power of attorney for healthcare. It's important, when you pick a person, to make sure that that person knows your wishes, is somebody you can trust, somebody who's available, can be reached when those decisions need to be made, someone who won't put his or her own wishes above your own, and also someone who is, when a family member wants you to get a different treatment than you would want, can handle the situation and step up to the plate. But also sometimes it's, there could be some life emergencies, problems, even with healthcare proxy. So it's important to have alternate proxy. So most of the time we see in the forms, 2 people, person, plan A, plan B. It's always important to have a plan B.
I would think in your, in your daily practice that this is something that you come across quite a bit then.
All the time. Yeah. And the situation you were mentioning before about so stressful to have to make decisions at the last minute actually happens all the time, which brings back the point of the importance of really trying to work ahead of time, trying to come up with a process in which you have thought about this and that you really have committed some time, which is going to save a lot of anxiety and trouble, both to the family, to your family, and also to the providers, the physicians. We recommend that when a patient, somebody feels one of these healthcare directives, that they will give a copy to their medical provider, to their clinic doctor, that they will be hopefully able to scan it into the electronic medical record, and also that they will keep it at home in a place which is not locked, so that family members will be able to find it, even give copies to those closest to them.
Is this something you might even post like on the refrigerator or something like that, or? Yeah.
Yeah.
Having it readily available.
Yeah, it's important. Even when a patient is going to the hospital, it's important to have a copy. You know, like the doctors tell you when you go to the clinic, you have to have your own medications. If you're going to the hospital, you have to have a copy of this document with you when you go.
Now you talked about it briefly, but how do you bring up this subject? It's so sensitive. Like, how do you go about doing it? Advice for people that might be watching?
I think the first thing to do is to realize how important this is. It's a matter of, in life, when we value something as important, we are going to get to it eventually. So I think really raising the awareness of how crucial this is. We are aware of this because we deal with it every day in hospital practice, but it's something that we should continue to try to educate each other on the importance. And then using family occasions, I would think when family gets together for Thanksgiving, for Christmas, whatever other celebration you could think of, depending on the culture and the community that you're looking at, really using those moments to talk a little bit about what's important. This can be a wonderful opportunity for going deeper in conversations among family. And it really takes for one person to try to ask a couple of well put together questions to try to trigger that conversation that then can lead to a more of a formal expression of wishes.
And you mentioned culture. Mohammed, maybe you could talk about that with the Somali communion. I mean, how is this received with them? Is it something they don't talk about, or is it, how do you approach it with different cultures?
Yeah, in Somali culture, in our culture, it's something we avoid this problem, this discussion. Always we have the attitude of, we'll get to it when we cross that bridge. We'll get to that bridge when we cross it. It's important to have this kind of discussions and what I tell the Somali families is, to understand the importance of this issue. We avoid these discussions out of love or out of respect. Sometimes we don't want to create anxiety to our loved ones, and so that's why we shut it off. We don't talk about it. But if you look into it, it's equally loving to have these discussions, because when you have these discussions as a patient, you know that your wishes will be executed and you will get the care that you would want in case of serious illness or accident. And also, it's on the other hand, also it's this document, this discussion, advanced care planning or healthcare directive, is important for your loved ones, because the people who will need to make those decisions will know what you would want, and you will be sure, and they will feel comfortable making those decisions in case you cannot communicate for yourself or in case you cannot decide for yourself.
What about with the Spanish community?
Yeah.
Is it the same kind of an issue?
Similar.
Culturally?
Some of the issues are similar, and actually I feel very strongly about the importance of addressing this issue. The research shows that minorities are less likely to complete an advanced directive.
Yeah.
And when I think about my community, the Latino community, even though people from many different countries, with different traditions and different ways of perhaps viewing end of life or death, there is a common denominator, which is in many of our countries of origin, there is a tendency to non-disclosure towards the end of life of serious diagnoses, meaning if a diagnosis of cancer, for example, is given, sometimes families or patients themselves may prefer not to know all the details, but to have the family make the decision as a group. And when you think about that, then having a document, having an advanced care planning process that have taken place in the years back, in which there is a clear expression of the desires of the patient for what he or she will or will not like, it becomes even more crucial. Because then families don't feel completely on their own, but they feel like even though they are able to engage in this non-disclosing all the details of this grave diagnosis, they still have the understanding, the permission, and the knowledge about what the patient himself or herself may have wanted. And this is just another strong argument, even why it would be most important to work on an advanced care planning earlier. So.
Yeah. I was going to add a great opportunity to bring up the topic in a more safe way is when a friend or family or neighbor is facing a medical crisis.
And that's how I found it personally.
And you can begin the conversation about them without the fear of, if you start talking about it, you're going to bring it on yourself, that you'll experience because you're talking about it.
Right. I know that happened personally when my father passed away. All of a sudden my mom, we started talking about it, and we knew exactly what she wanted at that point then too, even though she didn't pass away until years later.
Sure.
So there was no question what she wanted.
Yeah. We can help families. In the Latino culture, family decisions of this nature are viewed as a family matter, not as an individual matter. So really when we are trying to, how can we encourage our community to engage more on advanced care planning?
And how do you?
Well, you need to look at the family. You can, the principle of autonomy, of independence of the individual is really not as highly considered in our communities as it is the principle of keeping the family together. So really engaging relatives, bringing it up at the annual physical exam, as Dr. Haji Aden was saying.
Do you have time during a physical exam to do that?
Well, if not, at least planting a seed, or perhaps the clinic has a facilitator or an ambassador, somebody from Orange Choices that has been trained, somebody from the clinic that has been trained on advanced care planning, and can, once the conversation gets started, can take it from there. So it doesn't have to be the physician who does it all with the patient or the family. It can be other healthcare providers or members of the team that can do that.
Yeah.
And I would like to point out another thing, which is the healthcare directive is a living document, and things change throughout life. When you're healthy, you know, the decisions, the advanced directive decisions or healthcare decisions that you make are different than when you're ill and are diagnosed with a serious illness. So that's why it's always to remember what they call 5 Ds, which is number one, decade. So when every decade that you get older, you need to look into the document and modify some of those things. The death of loved one, also that, you know, when you see a patient, somebody you love who's in the hospital, who's having treatments, that may change some of your, thinking about healthcare. And you may realize a lot more things that needs to be done. Another thing is, when you're diagnosed with a serious illness, diagnosis. And another thing that's important is decline. You see sometimes, somebody who's been healthy otherwise, doing fine, and then all of a sudden they cannot take care of themselves. And I think that's it's an important time to modify the healthcare directive. Another thing is divorce. In case of divorce, it's important because that's changed the social situation. It may change the social dynamic. Then you may need to think about who you want to be your healthcare proxy or alternate proxy or things like that nature.
Really good advice. We just have a couple of seconds left. If they want more information about honoring choices or advanced care planning, where should they go?
Again, I would suggest visiting the Honoring Choices website, and there's a wealth of information there. The other location would be your own health plan or health care system website. They all will have this information.
Well, again, Doctor?
Talk to your primary doctor about it. I'm thinking in the Latino community, most community clinics have been or are in the process of really becoming more aware of this reality and training their providers and doing some significant efforts to make this something that should happen for every patient all the time.
Doctor?
Yeah, take every opportunity to educate your patients about this important issue.
Well, thank you all for being with us.